Desktop. Perfect. So now I'm on my practice fusion. Mm, I am going to stick to Mr. Smith because he was the patient I had created long time back, and any patient for that matter will be equally okay. Okay. Only thing is that please listen or please learn how I'm doing this whole thing. Feel free to stop me if you have any questions, and then we will go over some of the things what specifically related to the assessment part of it. I'm going to switch over later in like in between to Chioma's Professor Aniket's lecture last time because she took a class for assessment practicum in the previous for the previous class, and I think her slides are more than adequate because anyway on Saturday she will be taking this class and continuing with the concepts further. Okay, so just remember that. But let me first show you what we are expecting you guys to do, and then I will do those things uh, systematically one by one. But but the patient I am going to be using, let me be very clear, is the patient I created. What is going to be happening to you guys, like Charlene has created a patient based on her name, Eunice has created her own patient, uh, so Stephen has created his own patient. What are you guys going to do? Are you going to create a new patient every time? Let me know. Can somebody tell me? Eunice says no. Perfect. That's what I want to hear. Okay, you are going to continue with the same patient who like whom you have created under your name, because that's how you're going to be assessing. Charlene, we are saying that you are not creating a new patient every time. Is that clear? Okay. That's most important because I am going to be switching between the patients, but that is because I just want you guys to have a look at couple of things. But please, you do not create more than one patient. You continue populating the record under the name, under your own personal patient name. Okay. So my patient was Mr. Smith. How do I go about? I like now I want to create a patient. Can somebody tell me what should I be doing? Should I be adding a patient, finding a patient, or what? I'm looking for my patient. Where can I get some help? Perfect. Find the patient, which is here. There are two ways of doing it. We talked about it last week. But basically you can go and find the patient button here on the right hand side corner, or you can, I know this was Mr. Smith, so I'm just going to say Alan Smith. Okay, I'm not going to worry about too much about this patient, but I will just, I remember him. He was some 70-year-old patient. He was a school teacher, this that another, long time back. But uh, the history wise he was pretty much okay. Does anybody want me to quickly go over his history for a second? Let me know. Okay, fine. First name, find and add. Absolutely, guys. So everybody, does anybody want to know who this patient was? It really is not important. But what is a consensus? If not, I'm just going to go ahead. Let me tell you. So Mr. Smith was a patient. He presented sometime in a outpatient ambulatory clinic, and he had lot of problems. It's basically some skin rash allergy kind of a problem. Now when I'm there, I have to, like, if there was no chart note or no soap note, we can start one, which is not a case. You already have a chart note started for your own patient, and whatever is to be entered, the details of it and all that was given to you. There was a PDF document which I copy pasted for you guys and sent it over. I'm sure you guys have started working on, or you must have populated your own patient based on that information. Like for example, this was the, I'm sharing my PDF document with you guys, but this was a patient, whatever, like the name will be your own name, but you are 57-year-old, and then the insurance information was this, that the advance directive, this, that, another. We did this long time back. Is there any problem on understanding on any of this information? My patient does not have that information, but I'm sure you have done the first basic part of charting, the basic information, the insurance information, and the settings information in the whole thing, and some past medical history, the diagnostic history. Am I talking in ether or people are understanding? Okay, perfect, Eunice. I'm glad. So then I am going ahead, and so now you know that your patient, your subjective basic demographic information in the patient chart. You have your demographic information. You also have the summary where you have all, you have charted all various things, like the, what was the past medical history, the diagnostic history, this, that, and other. And I'm sure you have added the advanced directives as listed earlier as a part of your homework, the immunization. Of course, he's an old 78-year-old person, so there was no need for growth, this, that, and other. Okay, lifestyle, yes, you should, because then we said we can say smoking status, this, you can say alcohol addiction, whatever. Okay, I want you guys to now pay attention to couple of things. Can you see the section here called events? You can figure out what happened in various visits. For example, every time you do something with the chart or with the record, what happens is that an entry is created or a log is created. So let's see what happened here to Mr. Smith in March. Okay, maybe. And you can see that Choma Anike did something in March. Okay, because it in a multi clinician practice, it is important to know who was the person who altered or who went in the chart of the person and did something. And this is highly important because there is something called as audit trail, which you have to know. Uh, and this is something which is not part of assessment, but I'm just asking you. A flip side to that, can I go and delete some information? Am I allowed to do that? What do you think? I'm perfectly uh, legal, legitimate clinician working in the setup. For example, see here, I'm just showing you a screen. Choma saw this patient sometime. Okay, I'm just saying it hypothetically on 320 March 21st. There is no entry, nothing. So maybe she accidentally saw this patient. I will just go and delete this entry. Will that be all right? Had it been a real patient? What do you think? Eunice says it depends, and the rest of the people say no, no. No, the thing is, the answer is you should not delete anything. There has to be a paper trail. Uh, Yes, it can, but there has to be a paper trail. Even if you have got an authority or privileges as an administrator, ideally you should always, even if you delete something because it was a mistake or otherwise, there has to be a notification or noting. Because sometimes what happens is that it should not happen, but because you guys will be working in a real life setup, sometimes it may happen that somebody else's record gets imported by mistake. Nobody does it by choice. And then you definitely do not want that record there. Or there could be so many other errors. Over a period of time, it should not happen, but if it can happen. So an administrator or somebody who's having a maximum privilege can go and clean that record, but there has to be a note, there has to be an audit trail, there has to be a clear cut explanation. Otherwise, you can be liable for HIPAA violation. Okay, you have to remember this. You cannot just randomly go and check anything. You cannot go and randomly delete anything. Okay, because all these records are very sacred. Just remember that. And let me see how this works. What, even if you want to, of course I'm not going to do it. It says this will permanently remove the chart note and the action is not reversible. So that means if I do this by mistake, my patient will be lost forever from the system, from the record. I don't want to do that. So that's why using this delete button, be very careful. Okay. Editing is okay. Do not use the sign button because you guys do not have a signing privilege. And this is, remember, this is a demo setup. That was one thing I wanted to show you. The second thing I wanted to show you was this. I don't know. You guys may have done the vital signs, like the objective part last week. Have you? Charlene says no. No, we can't get in. Okay, you couldn't get in, but did were you shown at least the how to do the vital signs and all? Did the who took the class? I don't know. Did the instructor uh, show you how the vital signs are entered, how the things are done? Okay, yes, but please go over. Okay. Charlene says yes. Chike was not there. Chike, sorry to hear that you were not there. Anyway, it's not rocket science. It's not very difficult. I'll go over quickly. Okay, I'm not going to waste time on it. So essentially, vital signs are vital signs. So you have to pay attention to only certain things. And again, remember, if you make changes, if you do edits, there has to be a paper trail or there has to be an audit trail, not paper. Okay, this is all electronic. So remember the height in inches, and that is important because in, like here in Canada, we are in metric, so we talk about in centimeters. So to remember those small details, the weight in pounds, and this person is way overweight for some reason. I have made him 200 pounds. God bless. Of course, the body mass index has to be higher than normal and it has to be proportionate, okay? Because if somebody is obese, the body mass index will go up. The blood pressure of this gentleman was very, like, it's 150/95, but he's 78, so it's okay. He's not hypertensive per se. The temperature, the pulse, the respiratory rate. Now this I made it up, okay? And you are most allowed welcome to make up your own thing, but make sure that there is not a huge amount of discrepancy, okay? And nobody is going to quiz you on your medical knowledge. So just copy whatever is given to you as a case history. Then I remember talking to you about this Mr. Smith's complaints, but he had some skin rash 7 days back, increasing in size, whatever. He complained, and these are his complaints in his own words. The subjective part was He presented for the evaluation of rash because that's what he came for. And he had the rash has been present for several weeks. The onset was 7 days and associated with pain and redness. Now the objective part was important. Like me as a physician, when I see Mr. Smith, I will write where was this rash, how big was it, what were the dimensions, was there any other issues with it, was it vesicular rash, what type of fluid was the rash crusting, and in addition to that, I'm going to enter the vital signs, whether the patient had any other issues, this, that, and other. And then I found out that it was scattered papular eruption on back and abdomen. Okay. Now, this was a very plain simple thing. Mr. Smith came in and he just presented with something. He had a rash and nothing big. So my assessment was straightforward that it is some kind of a dermatitis. I don't know what it is. It could be either herpes or contact dermatitis, and I need to go and figure this out further. Okay. Now, me as a physician, for the time being, could go and give Mr. Smith some treatment. Okay, see, that's why the plan is left vacant. Or I could go send him to, say, a specialist, maybe a dermatologist. Or I could go and say, you know what, let me check your diabetes. Let me check something more. Let me do your blood work. Okay, and while I was examining him, if I write this down, I'm just saying for the hypothetical reason, I say that okay, I found some problem in your lungs. Maybe you got some pneumonic patch. I'm going to order an X-ray chest. Now suddenly I write the scripts for Mr. Smith. That's part of my assessment. So I'm just going to add some more information in assessment here. Okay. So just see what did I say? Okay, I'm saying refer to dermatology, blood work for diabetes, and X-ray chest. Okay. Now suddenly I have given three different additional tasks or additional uh, things for Mr. Smith to do and report back to me. Okay, in a real life setup, what happens is that all I will do is, this is a workflow. All I will do is I will decide something. I'll write a script. In a real setup, in a real life, when I say refer to dermatology, a note for the specialist will be created and sent across. The blood work, that's why there is this labs function, and the X-ray, similar thing. Like there will be some uh, other laboratory or other facility where you could go and say get the X-ray done. Okay. Here on this practice fusion setup, this is entirely a demo setup. Please remember that you do not have ability, meaning we do not have the luxury to order lab functions like this, because this is all a pilot or a demo setup. This is not a uh, mm, real life working of the EMR. In real life, when a clinician with particular privilege, he or she wants to do the labs, he will just click on labs here. See what happens, and please remember you are not doing this. What happens is that I when I click on labs, I get connected to number of different set of labs. Okay, depending on whichever lab I am connected to, or the patient has an insurance privileges. Okay, now moment I connect to it, or sometimes what happens is that the patient needs a particular type of lab. So there are tons of different reasons and the ways I can get connected. I'm not interested in doing that because this is a real life setup. So, and we are not connected to any lab. And again, none of you have got privileges here. Okay. But what we could do, so I'm going to cancel this. So what we are going to do though, we are going to give you in your fake patient, in your case history, you will be given a laboratory report. Okay. and that laboratory report, you will physically go and enter it in your assessment. Okay, that's what you will be doing. Nothing more, nothing less. You're not connecting to the labs. Just remember that. So all these functions, even though they are there in your practice fusion, please ignore. Okay, and see, I'm back to the charts because that's where I needed to be. So in the assessment, suppose I ordered for the blood work for the diabetes, and in a second visit or second follow-up, let me just do it here. Oh no, what should I do? I should save and then proceed. Okay. Okay. So don't worry about this. So I'm just showing you what has happened here. Okay. This is again somebody else has gone added something. All I want to show you is the information. All you have to do is in when you are in your own practice fusion assessment section, whenever you get a chance to do your own patient as a part of practicum, you will be copy pasting the information related to the labs in the assessment section. Okay, so remember I said we will have whatever diabetes. So I would just say fasting blood sugar was 7.8. Okay, mm, now again you have to know there are very many different type of what you say the units of measurement, but you have to be 100% sure whatever units of measurements they were. Okay, because normally it will be that this fasting blood sugar is way high. Okay, I'm not going to save it here. That's one thing. So very straightforward, but very basic. That you will be entering your lab reports, whatever those lab reports. I'm going to show you what exactly you will be entering in a minute. But you will be entering the lab reports in the section called as assessment. Because remember, assessment involves physician's assessment or clinician's assessment, as well as assessment from the laboratory, assessment from radiology, or any specialist or any other source of information. Okay, are there any questions in the assessment part so far? Oh, Charlene, I'm sorry to say stay, but I don't know how to answer that question to you. But yeah, we will keep the recorded lecture, and we will see you on Saturday then in the class. Okay.